From the thumbnail, you might confuse that the picture is of a filariasis. Yes, it's true, but the underlying cause is edema. And there is difference between edema and filariasis. It will be dealt at the end of video. So please stay connected. Let's get started. Edema is one of the disorder of hemodynamics that is marked by accumulation of fluid in tissues. Before knowing signs and symptoms of edema, let's know brief description about it. Normally there is balance between vascular hydrostatic pressure and plasma colloid osmotic pressure. Elevated hydrostatic pressure or diminished colloid osmotic pressure disrupts this balance and results in increased movement of fluid out of vessels. If the net rate of fluid movement exceeds the rate of lymphatic drainage, then fluid accumulates. Now we go towards signs and symptoms of edema. Edema most commonly seen in subcutaneous tissues, the lung and the brain. There is delayed wound healing and clearance of infections mainly noticed in subcutaneous edema, its distribution often influenced by gravity, so mainly appears in legs as shown in thumbnail. In pulmonary edema, the lung weight increased by 2 to 3 times and sectioning yields frothy, mixture of air, edema, extravasated red cells. In brain edema, the swollen brain exhibits narrowed sulci and distended gyri. Brain edema is life-threatening because brain substance can herniate through foramen magnum and there is loss of vascular supply to the brain stem, thus injury to the medullary center causes death. Now we discuss the actual mechanism of systemic edema in heart failure, renal failure, malnutrition, hepatic failure and nephrotic syndrome. In heart failure, the increased hydrostatic pressure directly causes edema. Other way is decreased blood flow to the kidney, and there is activation of renin-angiotensin system, then there is retention of sodium and water, which also occurs in renal failure. The retention of sodium and water causes increased blood volume and cause edema. In malnutrition, hepatic failure and nephrotic syndrome, there is decreased albumin content, so plasma osmotic pressure decreases as albumin is the main source of plasma osmotic pressure. Now we see the difference between edema and filariasis. Filariasis is a disease caused by parasite. And it is characterized by edema. And the underlying cause for this edema is lymphatic obstruction. Thanks for watching.